Signs that the Ebola crisis may be subsiding are being seen throughout West Africa. Health workers from all over the world traveled to the hardest hit nations to help. CCTV's Hendrik Sybrandy caught up with one of them in the U.S. 1 year after the first major outbreaks.
There's nothing better when you're a healthcare provider to see your patient make it.
It's an outcome doctors like David Cohn strive for. An outcome that too often was the exception rather than the rule while the Ebola epidemic was raging.
It's really incredible what these people have to go through.
Cohn, just back from West Africa, saw the toll Ebola took on its victims, both physically and psychologically.
They can be very sick, high fever, nausea, vomiting, diarrhea, all sorts of stuff. It's a terrible illness.
Dr. Cohn, an infectious disease specialist from Denver, spent 6 weeks teaching doctors and nurses how to treat patients with Ebola. He witnessed the highs and lows that come with this epidemic. This 13-year-old boy in red celebrated when he was released from a hospital in Sierra Leone, an Ebola survivor. Then he learned his 9 brothers and sisters and his father had all died of the disease. And the struggles of Ebola patients like this one didn't end there.
They have a certificate that says, I'm now immune. Doesn't matter. There's stigma, there's discrimination. You're not welcome back in this village. You're not welcome back in this home. Where do I live? How do I get food? Some very basic fundamental issues. It's very reminiscent of AIDS in the 1980s.
Today, a year after the Ebola outbreak exploded, Cohn believes there's reason for hope.
Things are light years better. I mean, clearly the early response was inadequate. The epidemiologists missed the boat. Now, it's at the other end, it's too much, too late.
He applauds the healthcare workers who he says united for a common purpose and common cause against Ebola. But he cautions that pockets of transmission still remain.
The biggest concern is it's not over.
It will take 42 days for a country to officially declare itself Ebola-free. In the meantime, he warns the world should plan for the next epidemic. It's not a matter of if, he says, but when.
We are not adequately prepared yet. A lot of work to be done.
Hendrik Sybrandy, CCTV, Denver.